Hi everyone, my name is Zhehuang Mao. In this video, I will present our paper ConsisTNet, a spatio-temporal approach for consistent anatomical localization in endoscopic pituitary surgery. Pituitary gland tumors are abnormal growths within the pituitary gland that can lead to symptoms such as headaches and visual impairments. For these patients, surgery is often required, and in recent years, endoscopic pituitary surgery has become increasingly common due to its minimally invasive nature. During endoscopic pituitary surgery, neurosurgeons must carefully identify a safe entry area on the scalp to access the tumor. This is challenging because the critical structures lie behind the sphenoid bone and are not directly visible in endoscopic views. Although existing deep learning-based methods show promise, prediction consistency, crucial for reliable clinical guidance, remains unsolved. Current anatomy localization methods are image-based and ignore temporal continuity, resulting in inconsistent predictions. Moreover, annotating video frames is highly time-consuming, so datasets are typically labeled at a low frame rate, such as 1 FPS, which limits the ability to learn temporal patterns. Therefore, in this paper, we propose a novel spatial-temporal framework for consistent prediction. We employ HRNet together with the convolutional LSTM to preserve high-resolution representations while capturing temporal information. To address the issue of sparse annotation in videos, we introduce a tracking-based label propagation method that generates dense labels to facilitate temporal learning. In addition, we incorporate a consistency loss that penalizes prediction discrepancies between consecutive frames to further enhance temporal consistency. Furthermore, we apply model acceleration to achieve real-time performance. In our tracking-based pseudo-label generation method, we use a point tracking approach to propagate annotations across consecutive frames. For landmarks, we directly track them frame by frame. For masks, we first sample the mask into a set of points, tracking these points across the consecutive frames, and then reconstruct the masks using concave hole geometry. In our work, we employ co-tracker, which demonstrates strong robustness for instrument occlusion. This tracking-based pseudo-label generation strategy is particularly effective when anatomical boundaries are not clearly defined. By using the tracking-based method, we expand our annotations from 635 images to 1,905 images. Importantly, these annotations are dense, which is beneficial for temporal learning. To validate our method, we employ 5-fold cross-validation in our experiments. In our experiments, we evaluate ConsisTNet in terms of both prediction accuracy and consistency, comparing it with state-of-the-art methods such as TensorRT, PNet, SSTAN, and MSTCN. In terms of accuracy, ConsisTNet maintains performance comparable to TensorRT and outperforms other image-based and video-based methods. In terms of prediction consistency, ConsisTNet significantly improves both segmentation consistency and landmark detection stability. By leveraging TensorRT, ConsisTNet achieves an inference speed of up to 202 FPS using FP16 precision. Here we present the qualitative results of our method compared with the state-of-the-art approaches. We can clearly observe improved prediction stability, particularly for landmark detection. In summary, ConsisTNet maintains a high accuracy of TensorRT while significantly improving prediction stability for landmark detection. Next, we plan to deploy ConsisTNet for preclinical studies and to collect and annotate additional endoscopic videos for more comprehensive validation. Thank you for watching.